Hi, I'm Sally Thibault. Do you know, last week I posted a video of understanding anxiety and children living with Aspergers and autism, and I received an enormous amount of responses and many shares on the video. So this week I thought I would do a very quick video on how you can help your child and you cope with the most debilitating aspects of the diagnosis, anxiety and stress. Anxiety is created when we feel unsafe for whatever reason. That feeling of being unsafe creates the overwhelm. The anxiety is also linked to a story or a belief. Now, often something that has happened before keeps repeating itself. As I mentioned in the last video, the amygdala in our brain is often referred to as the emotion center. The amygdala's responsibility is to keep you safe. That's its job. So if something has happened in the past, let's relate this to a child living on the autism spectrum. Perhaps they felt unsafe in the past because they were in a situation where things were out of their control, where they felt overwhelmed, or well, there was just way too much stimulation and they felt truly unsafe. Whenever they feel that that's going to happen again, or even now they're just overwhelmed with way too much sensory input, the amygdala swings into actually literally saying, last time this happened, you were unsafe, and now you need to fight, take flight, or freeze because it's going to happen again. Now, our role as parents and as educators is to understand this, to get to the bottom of it and help create the strategies where the children begin to feel safe. Now, it's important where everybody comes together to make a decision to create the best possible outcome for this child. Not the school, not the class, but for this child. It's then you can begin to create the best possible outcomes, not only for now, but for that child throughout their life. So, let's look at some strategies. Number one, don't just accept anxiety and stress as part of the diagnosis. It's not. Get to the bottom of the reason. Now, this may take some time and takes a concentrated effort to understand the situation from the child's perspective. Now, this is where journaling and open communication between home and school and the mindset of how can we create the best possible solution for this child must be foremost. We must, and I repeat, must, stop blaming the victim here. Anxiety is not something we want to feel. It's the result of an outcome. Number two, create a safe place where your child feels safe to express how they're feeling and have people around them who honor that feeling. Have compassion for the feeling. You know, I can see you feeling anxious. Let's take some time to breathe. Have a place they can go, whether that be outside where they can walk, or a quiet chill out zone, or a punching bag, or whatever it is. But allow the anxiety time to dissipate. Number three, give your child permission to say how it really feels. Now, this is setting the right tone for their later lives. I'm feeling anxious and overwhelmed, and I just need some time. Allow them to honor their own emotions. This is critical for when they get much older. Number four, essential oils are fabulous for creating calm. You know, we used to give my son a tissue with essential oils on them, and he loved lavender, sweet orange, and lemon. And I just fold the tissue up and pop it in a small Ziploc plastic bag that he kept in his pocket or in his pencil case. Now, whenever he was starting to feel stressed or anxious, he would just head off to the locker room or to the bathroom or somewhere where he could be by himself, and he'd take the tissue out of the bag just to inhale the oils. Now, it gave him time to calm down and something he felt he could do. He felt quite empowered by it. And of course, my favorite, tapping. And I've included a link below to tapping for anxiety. You know, something I've found to be so quick and effective, and something you can teach children to do for themselves. It works brilliantly for anxiety and helps release the emotion around the cause, lowering that cortisol level. Now, I hope some of these have helped. Now, if you have found a perfect anxiety releasing technique for your child that has worked really well, please share it in the comments box below. The more we can share techniques that have worked, the better outcomes we can create for all our children for their entire lives. And I just wanted to add a little bit to this. Remember, whatever you are doing now You're setting your child up for strategies they can use for the rest of their lives. Try and think with the end in mind. How do you want your young person, your adult child on the spectrum, to be able to cope with their anxiety as they get older? A question to hold in your mind whenever you're thinking about anxiety and your child. And I'll talk with you soon. Bye for now.